Hi Jonathan, it's Dr. Buford here with Dr. Moore. We're just getting started on the left shoulder. We're actually looking in from the front towards the back here. We did an initial assessment and found some interesting things. I'm going to go through them one at a time and show you. But as we look from the front to the back, the first thing I want to show you here is the glenoid, which is the socket part of the joint. We're looking down at it since you're laying on your side. This blue cannula is coming in from the back of your shoulder. And here's the first thing we can see here. You've got some tearing in the rotator cuff tendon. That's some partial tearing in the rotator cuff. We're going to debride that, and we'll take at least the #1 PDS and mark that, and maybe just put a ripstop stitch in if it's not a significant tear on the bursal side. But that's something that we picked up initially when we first looked inside, so you can see that there. Now, the other thing, next thing we picked up as an issue is we're looking at this posterior labrum, and it's torn. And so as we look down here, labrum's torn right through here. Okay, your shoulder was not loose on exam under anesthesia, but this labrum is certainly torn. And so we're going to place a suture anchor down here and just make sure this labrum's reattached. We're going to take a shaver and clean up some of the. Hold the shaver. Hold it. Yeah. Okay. So we're going to go ahead and pull back on the loose. Shave a little bit here. See the liberator for a minute. This instrument just functions as a rasp. And you can see the extent of looseness in the labrum here. It's got these sharp points on it that you see there. We can use this just to gently roughen up the soft tissue here. Well-defined anterior band of the infraglenohumeral ligament. Okay, so here we've placed a suture anchor at the edge of the glenoid, and it's very strong. You can see I'm pulling the whole shoulder when I tug on the sutures. Now we're going to reach in from the front. And I may need a picture. Maybe not. We're going to take one of the sutures out the front here. Just this one, like that. And next we'll take a suture hook. So we call it turn to the right. Here's the hook. You see it's loaded with a black wire that we call a super shuttle. And again, because you didn't have significant instability, we don't need to get a big piece of capsule. I'm just going to try and get underneath the labrum here. Not like that. Okay. Okay, good. Pause, please. Okay, record. Okay, so now as we pull back on the relay, it's going to bring that blue and white suture underneath. Watch your finger. Okay, so there it goes there. See it coming out. Okay, and we're going to tie that down right now. There's our post right there. show you what it looks like. Okay, so there's our anchor there. Let me see this. So that's very solid now. That's pretty solid. I do want to maybe trim that a little bit, but I don't think it needs an anchor. Okay, pause please. Okay, so we're looking anteriorly now. Our just orientation, our suture that we just tied is there. This is the anterior side of the joint, and this kind of confirms our exam under anesthesia. This band of the inferior glenohumeral ligament is well defined, solid, pretty robust. So I don't think it's an instability issue. The labrum's not detached. So I think we're going to finish up there as far as the labral repair, and now we're going to move on to the slab. So we're going to go off on the video and reposition our cannulas. Pause please. Okay, so now we're looking from the back to the front, and a couple things. First thing is it's hard to see, and it's hard to see because this rotator cuff has some tearing here. This is it hanging down. We're going to use our shaver just to debride the edges. And then if we have to do anything here, we'll do it after we repair the biceps anchor. So already we can see a little bit better. We can sneak around behind biceps usually like that. Okay, so that's essentially the extent of the rotator cuff injury, I think. So we'll leave that alone for the moment. Now we'll look at this biceps anchor. This is where it's loose. You can see this is loose right here. This is the biceps tendon in between the two cannulas, this cord-like structure running up towards 12 o'clock on the screen. Okay, and so I'm going to take our shaver, see if I can't place it down right in front of the biceps here. Got the bone exposed there. That's starting to look pretty good. The next step is we're going to place a suture anchor. This is also what we call a YKnot suture anchor. Get this straight. And this is a flexible, we call a flexible YKnot. This one's a little bit unique in that instead of having just one suture, this one has two. We're going to place it right about here. Take that down into the bone. more in just a second. Okay, so there you can see all 4 sutures, or all 4 strands. There's 2 sutures, 4 strands. There's a black one, or the black and white striped one we call the black one, and then the blue and white striped one we call the blue one. So we're going to take out 3 of the sutures here, and then we'll take a switching stick and take them outside the cannula, like that. And now you can see how those 3 are out of the way. And next we'll take our crochet hook and we'll take the one suture so that it's inside the cannula, just like that. And now we'll take a different angled suture hook. It's going to come through the blue cannula on the right side of the screen here. There it is, loaded with the same black wire. Start this. Yeah, I think you can see it just coming through the bottom there. Feed that through or reach in. Go ahead and load that outside the shoulder. And then as we pull back, you can see how that brings it underneath. Now we'll reach in and get the partner suture. So we want the other blue and white suture here, just like that. And that's going to be our first knot. Now to save us a step, save a little time really, we're going to take out one of the black and white sutures next. We'll take out this one. And then we'll position this one outside the gray cannula here just for safekeeping and for our next stitch. So now we're going to tie this blue one right here. Finish this and show you some more in a minute. Okay, there's the first suture tied, and now we're going to pass the second one. Here's the hook. Okay, so there we are with our second suture tied. And so now that's a nice stable repair of the biceps anchor. We haven't really captured the biceps, just the labrum. And what we can see here that's still remarkable is the rotator cuff, and that's the next thing we need to assess. Pause, please. I'll show you some more in just a minute once you clean up some of the torn edges. Okay, a couple things. You can see here we've got a needle coming in just on the anterior edge of this tear, and we're going to pass this PDS suture through. It's an absorbable suture. Now give me the picture, I don't want to grab it. And we'll just reach in here and retrieve the first edge of it, the first limb of this suture here. Okay. Now I just want to show you, look up at the insertion. What we've been looking at is the insertion actually looks pretty good. There's been a little bit of peel back, but in my assessment that's really less than 20% torn. So if we can do a side-to-side stitch or a couple side-to-side stitches if we need to, that may be all we have to do. We're still going to look on the bursal side before we make a final decision. That actually is not a bad spot right there. We'll pass a relay through here. Grasper. I'll back the needle out, and we'll go ahead and load that wire with the other end of the suture. So this serves as a marker stitch, and also if necessary we can tie it. And you can see how the goal here is just to prevent that from propagating. I think that's all we're going to have to do actually. We will go off on the video and have a look in the subacromial space. Pause please. Okay Jonathan, we're taking off a little bit of this anterior edge of the acromion bone. This is up above the rotator cuff and a part of the shoulder we call the subacromial space. The reason that we're doing this is just to make sure that there's nothing pinching on the tendon. Pause, please. Okay, so you can see how we're trying to make this level and flat here. Pretty good there. Okay, we'll go off on the video just for a minute. Okay, what we're doing here is we're just cleaning up the rest of the bursal tissue, and we did release the coracoacromial ligament because it was pretty stout, and I didn't want to leave anything that could potentially pinch on the rotator cuff since you had that partial tear. The good news is what I'm about to show you as far as the cuff goes. But before we do that, here's our decompression. You can see all the way out to the lateral edge. Okay. That looks good. The rotator cuff is absolutely normal on this side, which is what we were hoping to see. There we tied our stitch. You can see how that is going to hopefully prevent any further tearing. But on the bursal side it's normal, so I didn't feel the need to take down what was more than well over half of the cuff was intact. Actually probably close to about 80% of the cuff was intact based on what we saw on the articular side. So I think that ought to recover and be okay for you now that we have the bone spur removed and the ligament decompressed. We're going to finish up here and get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye.